Loretta, are you okay? Yeah. Great. Do you want to just stand here? Just when you come forward, yeah. Great. Good morning, everybody. It's wonderful to be here in Macquarie Fields at one of our fantastic vaccination hubs, seeing enthusiastic people getting their jabs. And I just wanted to make the really critical point today of thanking our communities in Western and Southwestern Sydney who've done an unbelievable job in coming forward to get vaccinated. We've seen vaccination rates go through the roof, and in every local government area of concern we've had at least 80% of first doses. In some communities, in Blacktown and Campbelltown, we've had over 90%. In Peter Sidgrave's electorate of Camden, we've had over 95% first dose. And in Mel Gibbons' electorate of Holsworthy, covering the Liverpool area, we've again seen vaccination rates around 85% first dose. And this augurs extremely well for us moving into the future. Across the state, New South Wales is at 84.1% first dose and 56.6% second dose, so edging closer and closer to that 70% double dose figure. I'm also pleased to announce that a third of our 12 to 15-year-old teenagers have already received their first dose, and given that's only been available in a short period of time, that's an outstanding result. To 8 p.m. yesterday, we had 1,043 cases of community transmission, and tragically 11 people lost their lives. And again, we extend our deepest condolences to all those, to the loved ones and family and friends of those people who lost their lives with COVID. And again, it's a reminder about how deadly the disease is and how important it is for all of us to protect the most vulnerable, to make sure we get medical attention when we need it, and to make sure we try as much as we can to prevent transmission of this disease. As I said, it's extremely pleasing to see Western and Southwestern Sydney increase their vaccination rates to such a high extent. And here at Macquarie Fields, we're seeing at least around 3,500 jabs every single day. And I want to thank the team here, led capably by Loretta Anderson, who'll say a few words about this example of the community really coming forward enthusiastically for getting the jab. But I do also want to make this really important point today. I'm always wary of using terms like Freedom Day, because when we start opening up, it has to be step by step. It has to be done cautiously. And we have to remember that even though people might be fully vaccinated, if you're vulnerable and have other conditions, you can still succumb and get the disease in a serious way or worse. So whilst we're all looking forward, it's almost a gallop to the finish line in terms of the 70% double dose, we need to make sure that what we do at 70% and 80% is done cautiously and also moderately. And to appreciate, as I will and as many will, that if you have elderly parents or loved ones, that even if all of you are fully vaccinated, all of us are fully vaccinated, the disease can still impact those closest to us. So everything we start doing, we're all looking forward to doing at 70 and 80%, has to be done with a degree of caution and responsibility, because otherwise too many people will end up in hospital. And every day I think about our hard-working nurses and hospital staff, doctors, clinicians, and also support staff like physiotherapists. Many people who've had COVID will take a long time to recover, and there's a whole support network of health staff supporting and working for them. And of course, we know in October we're anticipating those high rates of intensive care admissions, and we know the system will be overwhelmed, to use a technical clinical term, and we know that that's what we have to brace ourselves for. But in the meantime, I just thank everybody for getting the jab, but ask everybody to exercise caution once we get to that 70% double dose. Dr. Chant will now give the medical health update, and then I'll ask Ms. Loretta to talk about the Macquarie Fields Vax Hub. And again, can I thank all of the community leaders. Doesn't matter what party you're from. I want to thank everybody for being involved in supporting our communities. In particular today, I wanted to highlight Mel Gibbons from Holsworthy and Peter Sidgraves from Camden, who've just been working so hard, as have all colleagues from across all parties, to support our communities getting vaccinated and being safe. I'll now invite Dr. Chant to give a health update.
There were 1,043 locally acquired cases of COVID reported in the 24 hours to 8 p.m. last night, and one overseas case. There were 131,668 COVID tests, and we currently have 232 cases in ICU. Of note, we have continued to see a decline in cases in some of the heavily affected local government areas such as Canterbury, Bankstown and Cumberland, but we are seeing increased cases in particularly the Illawarra area. I do want to highlight the fact that we're asking everyone in the Illawarra, we've had 103 new cases reported, bringing the total number of cases to 1,001. The Wollongong local government area is the most impacted, and the Shell Harbour local government area. So I am urging everyone to be cautious. Please come forward to get tested, and also please get vaccinated. In terms of sewage detections, we've seen sewage detections in Lightning Ridge, Jindabyne, Crookwell and South Lismore. So as per usual, we just alert the community to those detections. I would want to particularly mention Jindabyne. Jindabyne's got a high level detection, and we often know that those high level detections do correlate with a case in that community. So please, particularly in Jindabyne, come out and get tested. In terms of Cowra, we have seen a number of cases transmit amongst young children, and that we want to thank the Cowra community for coming forward, getting tested and following all of the public health advice. Sadly, we are reporting the deaths of 11 people with COVID, and I just want to also extend my condolences to their loved ones. And I think, again, it shows that we cannot be complacent with COVID, and we need to take all of those precautionary actions and also get vaccinated. A woman in her 80s from Sydney's Inner West died at home. She tested positive after her death. She was not vaccinated, and she was a resident of a social housing complex in Camperdown. There was a woman in her 50s from Western Sydney, died at Nepean Hospital. A man in his 80s from southwestern Sydney died at Liverpool Hospital. A woman in her 80s from Sydney's Inner West died at Sutherland Hospital. A man in his 80s from Sydney's eastern suburbs died at Prince of Wales Hospital. A man in his 60s from southwestern Sydney died at St George Hospital. A woman in her 90s from Western Sydney died at Westmead Hospital. And a woman in her 80s from Western Sydney died at Royal Prince Alfred Hospital. And a man in his 80s from Western Sydney died at Westmead Hospital. He was a resident of the Hardy Guildford Aged Care Facility, and this is the fourth death linked to the outbreak. He had received 2 doses of the COVID vaccine and had underlying health conditions. A man in his 40s died at home in Western Sydney. That case has been referred to the coroner. That diagnosis was happened after death, and obviously we await the outcomes of those investigations. And there was a man in his 50s from Broken Hill, died at Broken Hill Base Hospital. So my key messages are to echo the Premier's words. It is really important that we continue to act responsibly to drive down those COVID infections. We are seeing pleasing declines, and that just shows with the combination of us trying to limit our social interactions, ensuring that we get vaccinated, that we can control the level of COVID. But it does require action by us all to hold the course, and hopefully we will see those numbers decrease in coming days to weeks.
Welcome Premier, Dr. Chant, Peter and Mel, and everyone here this morning. We welcome you to the Southwest Sydney Vaccination Centre, the largest in our region here on Dharawal country. Vaccination is our way out of this pandemic wave. Vaccination is safe, it's effective. It will protect you, your loved ones, your workmates, your friends, all of the people that you come into contact with, from the staff at the supermarkets to the healthcare workers who have continued to provide care throughout the pandemic. Please do it for yourselves, your families, and all of us, so that we can return to living normally. Southwest Sydney has been at the heart of the Delta outbreak. We have an amazing, diverse community with people from all over the world calling the suburbs of Southwest Sydney home. Addressing this diversity has been a key focus for us in our vaccination program to ensure timely and convenient access to vaccine for all. We have listened to our community and engaged with local leaders, and including faith leaders, local councils and multicultural services to provide timely, accessible and culturally safe vaccination responses in outreach and pop-up vaccination centres across Southwest Sydney, where the community feels safe and welcome. We have in language, vaccination resources and promotional materials available and provide interpreting services across all of our clinics. South West Sydney are particularly proud of the targeted engagement we have had with our Aboriginal communities across South West Sydney. We have worked closely with Aboriginal health and community leaders and services and have the highest in-state rate for first doses for our Aboriginal people at over 75%. We will continue to work to close the gap in vaccination rates for this population. Whilst health has taken the lead around this pandemic response, we could not have done this alone. Partnerships have and continue to be integral to our daily operations. We are truly grateful for the generous and enthusiastic support we've received from a large number of people and organisations, including but not limited to local emergency services, local GPs, community pharmacies, volunteer organisations, university partners and more. We have truly enjoyed working alongside you, are indebted to you, and you will all have a place in the South West history books. To the South West Sydney staff, many of who have been deployed from their normal working positions, we thank you for your energy, your commitment, flexibility and most of all your humanity in providing vaccination services to the people of South West Sydney. The South West Sydney Vaccination Centre has delivered more than 190,000 doses of Pfizer vaccine to the people of South West Sydney and almost 7,500 doses for our 12 to 15-year-olds in the last 9 weeks alone since we set up. It's a phenomenal achievement considering we first walked into an empty space which was previously a supermarket not so long ago. Across the district, we are close to approaching 500,000 doses of COVID vaccine administered since we first opened our Liverpool Hospital Vaccination Centre in February of this year. We have first dose rates above 90% for Camden and for Campbelltown, and most of our other LGAs are 80% for first doses across South West Sydney. We also offer vaccination not just at Liverpool and here at South Western at Macquarie Fields, but at the Prairie Wood Vaccination Centre and the Bankstown PCYC, and through pop-up outreach locations where we see a great need. To those of you who have already been vaccinated, we thank you. We have plenty of appointments for Pfizer vaccination here at South West Sydney, and there are various options, as I said, for walk-in across our district as well. To make a booking, put COVID-19 Vaccine Clinic Finder into your internet browser and book an appointment or take the opportunity to walk in to Prairie Wood or Bankstown, as well as any of our mobile outreach options. Please visit the South West Sydney Facebook page to find details of these clinics. As I finish, I would like to pay tribute to all of the healthcare workers that continue to providing care daily across our facilities, and to the people of the and to the people of the South West. And unlike my esteemed colleagues who have presented here at these press conferences of recent, who provide care in our intensive care units and our COVID-19 wards, who really would rather that the community stay away, we here want you to come. We need you to come, so make a booking, come on down, we will help you through the process and we will look after you. Thank you.
Premier, where is everybody? Set up for a crowd here and there's, not much of a queue.
Well, I'll ask Loretta to go over the facts, but I understand we have around 3,400 people getting vaccinated here every single day, and that's been a phenomenal amount of people, and I think in total we've had over 200,000 people vaccinated just in this one location. So it's a wonderful effort, and today we're saying thank you to all the workers and to everybody who's facilitated that vaccination. And as we know, we've made sure we've reached out into communities to allay any concerns people might have, and I'm just so grateful and thankful that the numbers speak for themselves. You don't have to take my word for it. Just look at the number of people coming forward every day in getting vaccinated. at, and especially here where the virus is still circulating at high numbers. We've had community respond in such a positive way, and I couldn't be more grateful, whether it's to the support staff, the medical staff, or to the community leaders, or just ordinary citizens who know how important it is to protect the families, their loved ones and themselves, and also to do their bit for all of us to get to those targets, and I couldn't be more grateful.
Regional government MPs say that they're sitting ducks and that under your roadmap to reopen at 70%, their vaccination rates are far lower, and they want non-essential travel. Sydney-siders going on holidays, they want them banned from coming to the regions. Are you willing to do that?
Look, we're always looking at what we do in terms of regional travel at 70%, and I think we mentioned that we'll look at what the case numbers are doing at that stage, but it's important to note the most recent update I had told me that there were only 7 LGAs that haven't achieved the 70% first dose, and obviously we're working very hard between now and the next few weeks to get all communities up to at least that level. But from what I understand, the briefing I received a week ago was there were about 26 local government areas that hadn't achieved 70% first dose, and then in a week that's gone down to just a handful. And whilst we appreciate all those concerns expressed by people, we will make the cautious decisions based on the health advice, and we'll make those decisions as we approach that 70%. But no doubt, as we know, as the Doherty report says, depending on the number of cases, will determine how mobile we can all be outside of our own areas, outside of Greater Sydney, if we're Sydney-siders, and we'll take that approach as we have on most things, in a cautious and considered way.
On 80% on vaccination rates among Aboriginal communities and people on the NDIS are lagging behind the general population by up to 15%. How confident are you that it's going to be safe to open up at 70% when some of the most vulnerable in the community won't have met that benchmark yet?
Well, as you know, the Commonwealth Government was responsible for vaccinating those vulnerable populations, and we've stepped up in New South Wales, found where the gaps are and engaged at a very local community level. So we knew the Commonwealth was in charge of those things, but as I said, New South Wales, I think, was the first state to put up our hand and say we want to help, we want to support our vulnerable communities. And I think on a number of occasions, whether it's Dr. Chant or myself or the Minister, we've said on a number of occasions that when we do start opening up, we don't want to leave anybody behind. We want to be proactive as we on the ground about what communities are going through, what they're experiencing, and what their attitude is. There are people who are still concerned, and our job is to make sure we provide as much information as possible and bring forward everybody together as much as we can.
Premier, when can we expect more information on what travel will be allowed at 80%, and also when will community sport be back?
Yeah, look, we're considering what things look like at 80% imminently. We've been doing some very good work already, and you know, the big question for us is not only what can vaccinated people do at 80%, but at what stage do we allow those that aren't vaccinated to participate? And they're the very challenging issues we're going through, and they're the issues we'll be informed by health from, but also obviously the national roadmap. So we're working our way through those challenging issues. What we were really keen to do was to give people a very good idea of what to expect at 70% and what they could do at 70% double dose. And obviously 80% double dose will also bring with it additional things that people will be able to do. And then obviously the challenging question after that is when do unvaccinated people, when will they be able to participate in those activities? And they're the challenging questions we're going through now as a government. But it will all be based on the health advice and consistent with the national plan. And I think this is a time, you know, I've often said this, it's always a horrible and difficult decision to take when you're asking people to stay home, when you're locking down communities, but that's easier than when you actually decide when you're coming out, because you have to do it in a safe way. You can't overwhelm the hospital system, and it's really important for us to make sure we manage the coming out process or the reopening process as safely and as cautiously as possible, because we don't want to overwhelm our hospital system. We want to protect lives, and we want to make sure that those who are vulnerable have every opportunity to be protected as well.
Premier, when can residents of New South Wales...
Premier,
when can residents of New South Wales expect some answers on that? You're discussing it at the moment, but when we hit 80% double dose, it's only a week or so after the 70%, we'll need some certainty.
We anticipate there'll be at least a fortnight between those two events, although it does depend on supply and a whole range of other things. It'll be imminent. We're going through those processes now. We've been discussing it for some time, but it's also important for us to know that what we expect things to be at when we start reopening is also critical in the decision making. So Dr. Chant and the team give us advice almost on a daily basis as to what we think things will be looking like when we hit 70% double dose, what we think they'll be looking like when we hit 80% double dose, because the key is, whilst people will be protected, whilst we know those high vaccination rates will mean serious illness will be prevented in many people, we still do need to consider the vulnerable, and you've got to weigh that up against young people wanting to get through the HSC, young people wanting to get into the career ladder. So it's a lot of consideration we're giving to what is a safe way to do this and how we live with COVID. But I'm confident that the path New South Wales will take will get that balance right. It won't be perfect, but we certainly are confident we'll get that balance right by giving people enough freedom to enjoy the things that we've missed, but also making sure we reopen in a very responsible and cautious way.
And how much communication has there been with businesses so they can prepare for what life looks like at 80%?
Yeah, the stakeholder management has been ongoing, and I can't thank industry and business enough for the patience they've demonstrated towards the government. I think they've all understood the position we're in. They've been in a similar position, and I think in New South Wales we take pride in really trying to consult at every stage, and we can't always give stakeholders everything they want or everything they hope for in terms of information or what they'd like, but certainly we've been able to work together to at least understand what concerns them the most, and obviously provide that certainty. But we've been pretty clear that at 70% double dose, only vaccinated people will be allowed into those hospitality premises, and we've also been pretty clear in the type of rules, such as the 4 square metre rule, that will be in place at that time, plus also the need for the QR code system. So we've provided that amount of certainty, and I know many businesses are enthusiastically looking forward to providing that service to their clients and opening up, and I just want to thank a lot of the businesses for hanging in there, especially the smaller ones. It has been such a struggle, but every business who has demonstrated resilience and has hung in there, I think will be rewarded, because there's so much pent-up demand. So many of us want to actually get out there and do things we haven't been able to do.
So, Premier, we just didn't get an answer on community sport, and also when do you think that will be coming back, and also travel, what can we expect at 80%?
No, I have answered both those questions. We're considering those things imminently as to when what people will be able to do in relation to those matters at 80% or 70%, whether it's community sport, whether it's travel. Obviously at 80% double dose, we're keen to see international travel and our quarantine system adjust to that. We've already started the trial in our quarantine system, so we're confident that 80% double dose will be able to welcome home lots more Aussies than have been able to come home before, because ironically the risk of welcoming home Aussies will be far less than the risk of the virus in the community. So we're really looking forward to welcoming home Australians through Sydney Airport once we hit that 80% double dose. And as for the other matters such as community sport and regional travel, obviously they're issues that we'll need to consider potentially up to the last minute, because it will very much depend on what the caseload and virus is doing at that time and what our intensive care situation looks like, because to date we're feeling very confident that the modelling we've relied on has proven pretty accurate. So at this point in time, the modelling has proven to demonstrate that what's happening on a daily basis is pretty accurate, but it's never perfect. And so we'll continue to watch that data as it comes in over the next few weeks. And as soon as we know, we will communicate the information to the public. But I think there's enough there for people to know what they can expect at 70%, at 80%, and also enough for people to know that we anticipate the gap between those two milestones is only likely to be a fortnight or 3 weeks at a stretch.
Premier, should we be start taking bookings, given the forecasts show that October 11th is firming as Freedom Day, or not what you want to call it, but is firming as restrictions relaxing, you know, when will they have confidence to start making those bookings?
Well, look, that's a matter for the businesses themselves, and I think we've been pretty clear that we'll start opening up on the Monday after we hit that 70% double dose, and we've been very efficiently putting out that information on a daily basis. So every day, everybody in the community can see what milestones we've reached, what double dose figures we're up to. So I think people can track reasonably where we're likely to be, and the Commonwealth has also provided that similar information. So it really depends on how quickly people take up the second dose. If, you know, it continues, we'd always said mid-October would be around the time that's going to occur, and of course it'll be the first Monday afterwards. I'm sure, you know, if it's on a Tuesday, we'll have to wait till the following Monday. If it's a Friday, well, obviously it's less time. But we're trying to give business as much notice as possible, which is why we put out our 70% roadmap quite a few weeks ago now, just to give everybody that information. It's likely to be one of two dates, but again, we want it to be a considered, staged reopening so that people still understand the risk but also appreciate the extra freedoms they have.
Premier, will we start to treat exposure differently? Will the fully vaccinated person who's a close contact still have to isolate for 14 days?
Yeah.
And what about a business? Do they have to close down for 14 days or can they stay open?
Yeah. So in terms of what we call in the Doherty plan, there are three planks that really determine how you live with COVID. One is obviously the vaccination rate. The second is the type of public health measures you have in place, like QR codes. And the third thing is what we call TTIQ, which is track, tracing, isolating and quarantine. And the health team at the moment is working on finalising that plan, which we'll make public. So we'll be able to give individuals and businesses good information on what to expect with contact tracing at 70% and 80%. But there's no doubt that if you have the virus, you still have to isolate at home. So we cannot have people exposed with the virus lurking around in the community. So, but again, how that will work and how it's managed, we'll make public. Obviously, you have a different system in place when you have 80% of the population double vaccinated than when we didn't. And so that contact tracing, which is critical, is one of the three planks in the Doherty report, Health is working on at the moment. And as soon as Health finishes that work, we'll make sure we make it public so people understand what to expect. But I can safely say that if you have the virus, you will have to isolate at home until you're not infectious anymore. So all of us, even though you're double vaccinated, are still encouraged to take every precaution we can not to get the virus and certainly not to expose people, especially those who may not be vaccinated.
Premier, New South Wales Health says that it's trying to recruit overseas health staff to help assist during the pandemic. How is that process going?
Well, we've already explained our plans on how we anticipate staff will be changing what they do or have been reskilling. So we've been planning for 18 months. New South Wales Health has been planning for 18 months for what we're likely to expect. And the point I want to make is whilst we're all gearing up for October, we know also that once you start opening up, case numbers will increase. They'll go through the roof. But the benefit will be when you have high rates of vaccination, we're hoping that we'll obviously have a downward pressure on the number of people that get hospitalised. So we still have to be careful about what happens in our ICU in November and December and beyond. We've been preparing for this. Our staff have been preparing. Obviously, there's been a call to arms from staff that might have an expertise in a different area, getting ICU capacity training, and that's been in process for the last year and a half. And the clinicians themselves have put the plan together, working with New South Wales Health, and we've conveyed that to the public. So we do warn that people will see things that have been done differently in health in the next couple of months. They may witness things, their loved ones might be in a hospital that's not close to home. So we're just wanting to warn everybody about what that pressure will look like, what that system will look like, especially when in the clinical definition the system is overwhelmed, which we anticipate it will be for at least a few weeks in October. That is really important for people to know that we've been working towards that and we've been planning for it. But as we say, in a pandemic, you can't always predict what's going to happen, but certainly we know that so far the numbers we're seeing in terms of the hospital system are about what the modelling told us. Hospitalisation rate is slightly less than what we assumed, but the ICU is about what we expected. So that tells us that October's likely to be as bad as we predicted it would be.
But what about the overseas health staff recruitment? What quarantine arrangements being made to ensure they can come into the workforce as quickly as possible?
Well, I don't have any updated information on that. The information I have is based on existing staff requirements, relying on local staff, relying on staff that have been retooled and retrained. So I don't have evidence that that's the case.
Premier, international students are planning on getting them back by the end of the year, but obviously vaccine restrictions are going to mean that people from key markets like China are not going to be able to come into Australia. Is that something that you'd like to see change, and how much is that going to hurt our university plan to kick back up again?
Yeah, so obviously we're really, first of all, we're prioritising Australians coming back home, and I want to make that very clear, but we're also really keen to allow universities to welcome back those international students. But yes, they will need to be double vaccinated with a vaccine that our federal authorities deem to be adequate and effective, and that's just the way it is. So we encourage anybody who wants to be part of our international student program in the future to get access to a vaccine which our federal authorities regard as effective, and I think our population would understand that. We don't want additional risk put into our system, and I'm really looking forward to those pilots commencing. Ironically, we're about to commence them just prior to the Delta outbreak. The Delta outbreak put a halt to those plans, and I'm really pleased the Treasurer now is in a position to be able to dust off those plans and see those flights come in. They'll be at the expense of the students, but our priority will remain welcoming home Australian residents, obviously.
Premier, on our vaccination rates, the second dose rate is quickly closing in on the first dose rate.
I didn't hear the first bit of the question.
The second dose rate is closing in on the first dose rate. It's about twice the pace at the moment. Does that concern you that maybe we're plateauing with the first dose and that means that's about all we'll get?
No, we always expected, remember when we put that really big emphasis on encouraging people to get their first dose, we knew that at a certain number of weeks later everybody would be coming in to get their second dose. So it's just the gap between the doses that we expected. But there's no doubt that once you start hitting nearly at 85% first dose, which is outstanding, there's no doubt that at a particular point we'll be saturated. Everybody who wants the vaccine would have taken it. Dr. Chant and I are hoping that'll be like 90 plus. So we're really encouraging people to keep getting vaccinated, and once we have 90 plus coverage of the first dose, we can feel very confident that New South Wales will not only be able to live with COVID, but live with COVID in a very safe way. So whilst we're at 84.5%, I think first dose today, we'd love to see that hit 90% as soon as possible. So I can't say enough, please come forward and get your first dose if you haven't. Please encourage your friends and family. It's safer for them, it's safer for you. But as I said, I'll still be cautious. I don't want to take the disease home to my parents, even when we open up, and I think a lot of people will feel like that. I'll be, watching what I do because I couldn't live with myself if I gave it to my parents. I haven't seen them for months, but I'd be petrified if I gave it to them. And I think all of us have to make those considerations. All of us have to think about how we're going to live with it, what our sense of responsibility and risk is. And they're the decisions that I want people to start thinking about. I know we're all thinking about the first things we'd love to do, as am I, but we also need to think about how we're going to act, how we're going to adapt to the fact that once we're opened up, we're going to have to live with the virus. We have to accept that people we come into contact with who might be fully vaccinated might have the virus and not, because symptoms will be even milder if you've been vaccinated. So these are all the challenges that await us. But it's also part of the challenge of living with COVID. Every single person on the planet is going to have to come to terms with this in some way. And we will lead the state and give the public the information they need to make those decisions in addition to what they'll be allowed to do.
Premier, you talk about bringing Australians home, but New South Wales has a pretty low cap on international arrivals at the moment. Can you lift that cap to try to get some people home or make it easier for people to come home?
We're still welcoming home more than any other state. Even though we've got the largest outbreak in the nation, we're still bringing home more Australians than any other state. Once we get to that 80% double dose, I would welcome having thousands and thousands of Australians come through Sydney Airport. There's not long gap now. So I would feel very comfortable once we get to that 80% double dose vaccination to have Sydney Airport be the gateway to our nation in welcoming home Australians who've been stranded overseas for months and months, who want to be reunited to their families, who just want to get back home. Nothing would give me more pleasure than that. And certainly once we get to the 80% double dose, I can assure the community that New South Wales won't only do its bit, but will do its bit for Australia. And I listen.
No cap at 80%?
Well, I'm anticipating that it will only be limited by people being double dose vaccinated. So it will really be upon people being double dose vaccinated. And If airlines want to put on extra flights to Sydney, that will give me great joy. It means more people can come home, and also in an affordable way, because we know, because of the way things have been working, a lot of Australians have been stranded, have been priced out of coming home when they want to, and I want to see that end. But I also say to the other premiers, I certainly know what we've been copping here in New South Wales in terms of rhetoric, but I just hope that everybody does their bit for the nation and does their bit for each other. Our citizens all have equal opportunity and equal value on human life. We're all in the business of protecting our citizens and keeping Australia safe, but we also need to be compassionate and help each other out. I hope that people will appreciate that New South Wales' contribution before any other state will be to welcome home thousands of Aussies who've been stranded and reunite families who for too long have been suffering.
Dr. Chant, just one for Dr. Chant. The healthcare worker deadline for vaccinations is next Thursday. That's looming. How many exemptions has New South Wales provided? How many healthcare workers have applied and received an exemption for getting a vaccination?
Look, I haven't got that data in front of me. There are a couple of areas where people have temporary exemptions for. On our website there is a medical exemption form that needs to be filled out by a clinician. We would see that there'd be a very small number of reasons, given the fact we've got a choice of vaccine, and if you've had a reaction to one, you are mostly eligible for the other vaccine. So I would be very optimistic that healthcare workers will embrace vaccination, and I'm really looking forward to having a highly vaccinated workforce that will protect both their colleagues and, most importantly, their patients.
In terms of over 60s, how concerned are you about the vaccine rates among over 60s, and how concerned are you at the reports we're seeing, especially in southwest Sydney, that a lot of over 60s are waiting for Pfizer?
Look, my message to everyone is the vaccine you have in your arm is the vaccine that you need, particularly when you're in the midst of a Delta outbreak, and that's been our message for many months. I should say that there are a number of access points that people have. We've seen increased Pfizer supply, particularly through general practice, and there is also Moderna going through pharmacies. But I would just urge everyone to get a vaccine now. As the Premier's indicated, we have the opportunity to demonstrate to the world that we can be the most highly vaccinated country. I think there are a couple of areas where we've almost got well over 90% vaccine coverage, in some populations 95%. I actually think we can aim for the highest possible vaccine coverage, and that will allow us to go about our business in a more normal way. Now, can I stress, we will not be ever having to go back to pre-COVID levels. We always going to have to be mindful that COVID exists. We're going to have to engage with booster shots. We're going to have to engage with advice from time to time. When we see outbreaks, we're going to have to respond. So it's not going to go back to normal. We can't deny that we're going to have to live with COVID. But having those very high vaccination levels will allow us to have more minimal restrictions or more minimal public health measures in place as we navigate the future years with COVID.
Dr. Chant, how worried are you about supply? How worried are you about supply? The Health Minister yesterday said that there's no clarity actually how many doses of Pfizer we're going to be getting from October onwards, and that remains a mystery.
Look, obviously from our perspective, I am so thrilled by the uptake of vaccine and the thirst for communities everywhere to get vaccinated. I would be disappointed if we couldn't meet that demand, but I think it's important that I haven't had the opportunity to read what the Health Minister said or get myself across that, so I do not want any fear to be created. At the moment, we have the opportunity for Moderna going through pharmacies. We've got GPs that have had increased Pfizer allocations. We know vaccines are being also pushed out through AMS, Aboriginal Medical Services, and we know our districts also have pop-ups and other access points. So the message to the community is help each other find the right place to get vaccinated, but don't delay. I want to see us get to 90% first dose by next week. So please, everyone, help. Let's get that first dose in.
You just said that you previously said that you want to see extremely high rates of vaccinations in vulnerable communities, Aboriginal communities, people with mental illness, the homeless. Do you think it will be safe to open up at 70% when these groups won't have met that vaccination target?
Can I just say that everyone is focused incredibly on looking at where the gaps are. So, for instance, we're looking closely at where we might have suburbs or local government areas with lower vaccine coverage. We're reaching out to communities. We're working with our non-government organisation partners. And so I am conscious that I want a very even vaccine coverage. And I can just say thank you to our local health districts, and I just want to acknowledge the work in particular of southwestern Sydney that I'm familiar with, that have been doing a lot of work, you know, outreach into communities such as Green Valley, Claymore. They've been doing pop-ups in religious centres, in YMCAs. They've been doing a whole lot of work in terms of providing access points for people that would otherwise have challenges. And as Amanda Larkin would say from the CEO district, they have one of the highest rates of Aboriginal vaccination coverage. Now, do we need to do more? Yes. But I'm asking everyone to redouble their efforts over the next couple of weeks so that we leave no one behind. And in terms of prisons, we're also doing a lot of vaccination in prisons. So yes, it will take us time. Yes, we have to have a sense of urgency and partnership, because everyone has a role to play in getting our community to be highly vaccinated.
Dr. Chant, just in terms of schools, do those air purifiers work in schools?
In terms of schools, I would just say that ventilation is a key component. We know that Delta, more so even than the other, can be transmitted from children to children, and it is important that we create those classrooms with excellent ventilation. Education is working on doing an audit of schools and looking at how to optimise that, and so we need to look at it a case by case. I'm not an engineering expert, but I can just tell you that having good airflow, good air exchange is going to reduce the risk of transmission in those settings. But I should also say there is never one solution. We've got to ensure that sick children don't go to school. We've got to ensure that children are getting tested promptly. We've got to ensure that there is good distancing, there's cohorting. So like all things, we need a suite of strategies to reduce the risk of transmission and keep our children safe.
Last one on the vaccine. Can we just ask one on the vaccine hub? Sorry. Are there appointments available today?
There is appointments for tomorrow and Sunday. There's plenty.
Can you just take that off and just step up to the microphone and give us that?
There are appointments today available. There are about 500 tomorrow, and there's quite a number in the thousands on Sunday available.
First or second dose?
Either.
Yeah.
Yes.
Okay, thanks.
Thank you.